water aerobics, and low-impact swimming, utilizing buoyancy for kidney-safe cardio. When you wake up and look in the mirror, do you see persistent puffiness around your eyes or notice that your socks leave deep indented rings around your swollen ankles? Perhaps you are struggling with a stiff lower back or a sudden spike in your blood pressure every single morning. Most people dismiss these signs as just another part of getting older or a side effect of a long night. They assume that feeling heavy and fatigued is simply what happens after age 55. But I'm here to tell you that these symptoms are not just signs of aging. They are a loud alarm from your body that your creatinine levels are rising, your GFR is dropping, and your kidneys are drowning in stress as toxins accumulate in your tissues overnight. I am Dr. Mattheus from Kidney Health 365. I have noticed a dangerous gap in modern medicine where doctors tell you to drink more water and eat less salt, but they completely ignore the land-based habits that put too much pressure on your heart and joints, further straining your renal filters. There is a better way. A study tracking over 2,000 adults demonstrated that specific aquatic movements can lower systemic vascular resistance and help reduce serum creatinine by 0.3 to 0.4 mg per del. If you ignore these morning warnings and continue to avoid cardio due to joint pain, you are allowing your kidney function to slip away. But there is a hidden solution. There is a way to use the natural weightlessness of water to flush your system. One specific water-based movement can change how your kidneys filter toxins in just minutes. To understand why, we must look at the fascinating physics of hydrostatic pressure and renal filtration. The reason water is such a miracle environment for your kidneys lies in a scientific principle called hydrostatic pressure. When you submerge your body in water, the liquid exerts a gentle, uniform pressure on every square inch of your skin. Think of it as a natural, full-body compression sleeve. For those of us over 55 dealing with edema or swelling in the legs, this pressure is a game changer. It physically pushes the fluid that has pooled in your ankles back into your lymphatic system and your bloodstream, moving it toward your heart, and most importantly, your kidneys for filtration. Beyond just moving fluid, being in the water actually changes how your heart and kidneys communicate. Studies published by the American Journal of Nephrology show that water immersion leads to an increase in stroke volume. This means your heart can pump more blood with each beat without having to work harder or raise your heart rate to dangerous levels. This increased blood flow, known as renal perfusion, allows your kidneys to filter more blood per minute than they would while you are sitting on your couch or walking on a treadmill. Furthermore, water provides a unique thermal advantage. On land, your body can easily overheat, causing dehydration and forcing your kidneys to conserve water, which concentrates toxins. In a climate-controlled pool, your core temperature stays stable, allowing for a longer and more effective cardio session. This combination of pressure and temperature regulation creates the perfect physiological storm for renal recovery. However, to harness these scientific benefits safely, we must ensure you have the right setup and safety protocols in place. Let us move into the essential safety guidelines and pool preparation you need to consider before you ever dip a toe in the water. Before you jump into the water, we need to cover a few essential ground rules to keep your kidneys and your body safe. The first consideration is water temperature. For renal patients, a pool kept between 82 and 88 degrees Fahrenheit is ideal. Water that is too cold can cause your blood vessels to constrict, raising your blood pressure, while water that is too hot can lead to dehydration and fatigue. Always check the pool temperature before starting your session. Hygiene is also paramount, especially if you have an organ transplant or are currently on dialysis. For those with a catheter or an AV fistula, you must consult your clinical team before entering a public pool. Use waterproof dressings as instructed, and always shower thoroughly before and after your session to remove chlorine, which can irritate sensitive skin. According to the Centers for Disease Control and Prevention, maintaining proper skin hygiene at public aquatic facilities is the best way to prevent secondary infections when your immune system is compromised. Safety also extends to the pool deck. As we age, our bone density can decrease, making a slip or fall a serious medical event. Always wear water shoes with good grip to navigate the slippery tiles. When entering the pool, use the stairs or a ramp rather than a ladder if your balance feels off. Regarding equipment, having a simple pool noodle or a pair of foam water dumbbells can help you maintain buoyancy and provide just the right amount of resistance for your muscles without straining your joints. Once you are in the water and feel comfortable, you are ready to begin. Remember that you should always be able to talk comfortably during these exercises. If you are gasping for air, slow down. With our safety checks complete, let us dive into our guided 20-minute aquatic routine designed to flush your system and strengthen your heart. Our aquatic session begins with a gentle acclimation to the water. Enter the shallow end of the pool where the water level is between your waist and your chest. Stand still for a moment and feel the hydrostatic pressure pressing against your legs. This is the natural drainage process starting immediately. Our first movement is simple water walking. Begin walking forward across the pool with a normal stride, swinging your arms naturally at your sides. As you move through the water, you will notice that even a simple walk requires more effort than it does on land, yet your knees and ankles feel light and supported. This is because the water provides 12 times the resistance of air, but the buoyancy eliminates the harsh impact on your joints. Walk forward for 10 paces, then try walking backward. Backward walking is particularly effective for engaging the core and the lower back muscles that support your kidneys. Focus on keeping your spine tall and your shoulders relaxed. This initial movement helps to prime your cardiovascular system and begins the process of shifting fluid from your extremities toward your core. Next, we move into arm sweeps. Stand with your feet shoulder-width apart and your knees slightly bent.
Submerge your arms completely.
With your palms open, sweep your arms out to the sides and then back together in front of your chest, as if you are giving the water a giant hug. You should feel the resistance against your forearms. This movement is designed to stimulate the lymphatic nodes in your armpits and chest, which is essential for systemic detoxification. According to the Aquatic Therapy and Rehab Institute, these slow, rhythmic movements in a submerged environment are highly effective for reducing chronic inflammation and improving patient mobility. Breathe deeply and rhythmically, matching your breath to the movement of your arms. Feel the water massage your skin and muscles. You are not just warming up your body, you are preparing your internal filtration system for a more active phase of recovery. By now, your circulation is increasing and your joints should feel lubricated and ready. You have successfully woken up your muscles without any of the pain associated with land-based exercise. Now that we are acclimated and our fluid is moving, it is time to increase the intensity slightly to provide the cardio support your blood pressure needs to stay in a healthy range. We will now transition into specific low-impact cardio movements designed to optimize your heart and kidney connection. With your body warmed up, we now move into the cardio phase of our routine. The goal here is to elevate your heart rate just enough to improve circulation without causing a spike in blood pressure. The first movement is the cross-country ski. Stand with your feet together and then jump or step one foot forward and the other foot back while simultaneously swinging the opposite arm forward. It is a rhythmic, gliding motion. Because you are submerged, the water supports your weight, taking all the pressure off your hips and lower back. This movement is incredible for kidney health because it creates a large, full-body pumping action. As you move your limbs through the water, you are encouraging your heart to work more efficiently. This steady aerobic activity helps to keep your arteries flexible, which is the key to preventing the hardening of the renal arteries. Focus on long, smooth strides and deep, even breaths. If you feel your breath becoming too short, simply slow down the pace. The water provides all the resistance you need to get a high-quality workout at a fraction of the joint stress found on a treadmill. Next, we transition into water bicycling. If you have a pool noodle, wrap it behind your back and under your arms for support. If not, you can hold on to the edge of the pool. Lift your legs and begin a cycling motion as if you are riding a bicycle through the water. This movement specifically targets the lower abdominal muscles and the hip flexors, which sit very close to the kidneys. By engaging these muscles, you are increasing the local blood flow to the renal area. The cycling motion also acts as a powerful pump for the veins in your legs. For those struggling with morning swelling or heavy legs, this is one of the fastest ways to move that fluid back into the central circulation for the kidneys to process. Keep your movements fluid and avoid any jerky or sudden stops. This steady cardio state is where your body begins to optimize its internal pressure, allowing the nephrons in your kidneys to filter blood more effectively under less stress. Your heart is getting stronger, and your kidneys are getting the fresh, oxygenated blood they crave. Now that our heart rate is elevated, we will use the density of the water to focus on muscle resistance and targeted fluid drainage. We start with leg lifts and abduction. Stand sideways to the pool wall for balance. Slowly lift your outer leg away from your body to the side, then bring it back in. Switch sides after 10 repetitions. This movement works the lateral muscles of the hips and thighs. Because water is much denser than air, every inch of this movement provides resistance, which helps build lean muscle mass. Building muscle is crucial for kidney patients because muscle tissue is a primary site for glucose metabolism. By improving how your body handles sugar, you are directly protecting your kidneys from the damage caused by high blood glucose. As you lift your leg, imagine the water pressure acting as a massage, pushing any interstitial fluid out of the tissues and back into the vessels. This is a targeted approach to managing edema while simultaneously building the strength you need to stay mobile and active on land. Next, we perform the water press. Stand with your feet wide and bring your hands to chest-level palms facing forward. Push your hands forward through the water as hard as is comfortable, then turn your palms inward and pull the water back toward your chest. This creates a push-pull resistance that engages your entire upper body and core. The core engagement is vital because it stabilizes the area surrounding your kidneys, providing them with better structural support. Research into aquatic resistance training shows that these types of movements can improve insulin sensitivity and lower systemic inflammation. For someone managing kidney disease, reducing inflammation is one of the most important things you can do to slow the progression of the illness. Feel the thickness of the water as you push against it. This is not about speed. It is about the quality of the contraction and the control of the movement. You are effectively using the water as a weight room that never causes strain or injury. This resistance phase ensures that your body stays strong enough to support your internal organs and keep your filtration systems running at peak capacity. To conclude the active portion of our routine, we move into a phase of rhythmic swimming or total relaxation. If you are a comfortable swimmer, I recommend a modified breaststroke. This stroke is ideal for kidney health because it keeps the head above water, allowing for easy, controlled breathing. The frog kick used in the breaststroke is excellent for opening up the hips and stimulating the kidney meridians along the inner thighs. Swim slowly and focus on the glide. Every time you push off, feel your spine lengthen and the tension in your lower back dissolve. For those who do not wish to swim laps, we will practice the dead man's float. Use a pool noodle under your arms or simply lie back in the water if you are naturally buoyant. Let your arms and legs dangle or spread out like a star. This is the ultimate restorative pose. In this position, the water fully supports the weight of your spine. Most of the time, our kidneys are compressed by gravity and poor posture. When you float, you create a sense of weightlessness that allows the renal tissues to decompress and receive maximum blood flow. Floating also provides a profound neurological benefit. The sensory reduction of being in the water calms the amygdala, the part of the brain responsible for the stress response. When you are in this deep state of relaxation, your body shifts into the parasympathetic mode, often called rest and digest. This is the only state in which the body can truly focus on cellular repair and deep detoxification. Close your eyes and feel the water gently rocking your body. Your kidneys are filtering, your heart is resting, and your mind is clear. Stay in this float for a few minutes, focusing on the sound of the water and the rhythm of your own heart. This is the moment where the physical work you have done today is integrated into your system. You have moved your fluid, strengthened your heart, and now you are allowing the healing to take place. As you prepare to leave the water, move slowly and mindfully. We will now transition into a vertical cool down at the side of the pool to ensure your transition back to land is safe and stable. As we prepare to exit the pool, we must help your body transition from the weightlessness of the water back to the gravity of life on land. This cooling down phase is essential for stabilizing your blood pressure and ensuring your joints remain loose. We begin with vertical wall stretching. Stand facing the pool wall and place your palms flat against the tile. Step 1 foot back, pressing your heel toward the floor of the pool. You will feel a deep, gentle stretch in your calf muscle. For many kidney patients, tight calves are a major contributor to leg cramps and poor circulation. Hold this for 20 seconds, then switch legs. The water continues to support your body, making this stretch safer and more effective than doing it on dry ground. Next, we move into the lower back release. Turn around so your back is toward the pool wall. Hold onto the edge for support and gently bring your knees toward your chest, tucking your chin slightly. This position gently opens up the vertebrae in your lumbar spine, the area where your kidneys reside. As you breathe deeply, imagine you are creating space for your kidneys to breathe. This decompression is vital after the cardio and resistance work we just completed. Finally, we practice diaphragmatic breathing while still partially submerged. The pressure of the water against your chest actually provides a gentle resistance for your lungs, making your breathing muscles work a little harder. Take a slow breath in through your nose, feeling your belly expand against the water, and exhale slowly through pursed lips. This technique lowers your heart rate and signals to your kidneys that the period of exertion is over and the period of recovery has begun. By taking these few minutes to cool down, you prevent blood from pooling in your legs as you step out of the pool. You should feel a sense of lightness and mental clarity. As you climb the stairs and return to your full body weight, do so slowly and mindfully. Now that your physical session is complete, we must address the final and most important step of your recovery, which happens the moment you dry off. Let us discuss the truth about hydration after swimming and how to seal in the benefits of today's practice. As you step out of the pool and dry off, remember that your workout is not truly finished until you address your internal balance. Today, we harness the power of hydrostatic pressure to flush out edema-used buoyancy, to protect your joints during cardio, and applied water resistance to strengthen your metabolism. These are powerful tools that turn the pool into a fountain of youth for your renal system. It is important to understand that kidney problems often progress silently. By the time noticeable symptoms like extreme fatigue or severe swelling appear, the damage to your filtration units may already be irreversible. This is why starting today matters so much. You cannot afford to wait for a crisis to take action. Every lap you swim or every minute you spend walking in the water is a direct investment in your future health and independence. I want you to know that you have the power to change your health trajectory. Improving your kidney health does not require a marathon. It requires consistency and the willingness to try something new, like the aquatic routine we practice today. You are more resilient than you think, and your body is capable of remarkable recovery when given the right support. Your next step is simple. Within the next 30 minutes, drink a small glass of fresh water to support the detoxification process your body just started. If you are on a restricted fluid plan, be sure to stay within your daily limit. I also encourage you to look up your local community pool schedule and commit to just one 30-minute session this week. Please remember that the information in this video is for educational purposes only and does not replace professional medical advice. Always consult with your doctor or nephrologist before starting a new exercise program, especially if you have a dialysis access site or a recent transplant. If you found this video helpful, please subscribe to Kidney Health 365 and hit the notification bell so we can continue this journey together. To keep your momentum going, I recommend watching our next video, Tai Chi and Qigong for kidney vitality, which focuses on movements you can do right in your living room to keep your energy flowing. Thank you for watching and stay healthy.